Hello everyone. Welcome to the podcast series by Pragnya Charitable Trust and Perseverance. Today, we are diving into a meaningful conversation on the topic of parental burnout and emotional well-being. We are honored to have the therapist Ms. Parvathy here to share valuable insights and experience on the same topic. Hello, Ms. Parvathy. Welcome to the podcast series. We are truly happy to have you here.
Thank you so much. I am also very happy to be here now.
My first question is, what exactly is parental burnout and emotional well-being in the context of raising a child with autism spectrum disorder?
Parental burnout is a state where the parents feel deeply exhausted, like in all way, emotionally, mentally, and physically. So this happens because the demand of parenting become high, which means that they won't get enough rest or enough support. So in the case of the children with autism, the parents feel more burnout or more intense emotional feeling. So this happens because they have to maintain all the things, like they have to maintain daily activities, their behavioral challenges, their communication problem, their future worries. So these are all maintained at the same time. If the burn we can reduce this burnout, but they have to open up to themselves or to others.
Okay, that really helps us to understand how deep it is. So the next question is, from your perspective, how common the parental burnout among the parents of children with autism?
So the parents that have the children with autism, it's very common among them because most of the parents, as I said earlier, they are afraid to express their feelings or afraid to express their emotions because they feel that they have to stay strong for their child, or if they express their feeling, they will be judged by others. So but I think that's not the solution. They have to be expressive and they have to seek help if they need. So we can reduce burnout actually by expressing or their emotions, and can openly talk to anyone. So if the emotions become unsupported or unexpressed, the chance of increasing burnout is high.
So it is very common, right?
Yes, very
So
common.
what emotional challenges do parents typically face while raising a child with autism spectrum disorder?
Okay, the parents feels a mix of emotions. They have to maintain the daily activities and responsibilities, and they are very anxious about the child's development and future. And some may feel difficult to what to do in when the child show behavior. They may be very confused. What I will do now? Uh, that make them very shocked or
Mm-mm.
scared. And some may be like compare their child with other children. That can make them very nervous about their future and all. So I think there is no need for that tension and all. If anything happens or if any emotions is going on through their mind, they have to open up to others.
Okay.
That can help them to reduce and can maintain their daily activities and all.
That sound like very difficult to parents
Yes.
also. How does the parental burnout shows in daily life, and what are the early signs that the parents always miss?
So the thing is that the burnout does not happen suddenly,
Mm.
develops slowly. So many parents feel loss of interest in the activities that they loved to do earlier,
Mm-mm.
and they may be stuck in this small environment with their child. So they are like they have to take care of their child. What will I do if he is getting behavior? They will be tensed. So they will forget what they enjoyed earlier. They will forget about themselves, and sometimes they will have this negative thought like, am I doing enough
Mm.
or am I failing? These negative thoughts can increase the chance of burnout. So they have to open up to someone.
Okay, so these are the early signs that parents have to notice,
Yeah.
right? So, what kind of conversation parents be having with themselves that they should often avoid?
So the parents have to be honest with themselves. See, some parents will afraid to ask, "Am I okay?" because they think that child's need is more important than theirs,
Mm-mm.
and they may not ask to others that I need help, because they may feel if they ask for help, they may feel weak, or they want to be, or they feel they are dependent on others. So the thing is that many of the parents won't recognize their limit. They are like, they have to do all the things by
Mm.
themselves. Don't want to seek any other help. So this type of things can increase burnout. So they have to be honest with themselves.
Yeah, that's true. Sometimes many parents forget to check on themselves sometimes. Okay, like how do you help the parents to move from the mindset of fixing the child to understanding the child?
So many parents are trying to fix their child rather than
Mm.
understanding.
Mm.
Autism is not something that need fixing. it is another way of experiencing and understanding the world.
Mm-mm.
So the rather than controlling them, the parents need to understand their emotions.
Mm-mm.
Like if a child is showing a behavior, they have to find out why they are showing that behavior
Mm-mm.
and at what situation make them do that behavior.
Okay.
And they have to find out the small interest and small strength
Mm.
that the child have. So while changing their mindset from controlling to understanding, their relationship with the child can be increased and
Mm-mm.
that become peaceful, and the child will respond to them even more better.
Okay, so the understanding is more important than fixing the
Yes.
child. So, what advice would you give to the parents who have just received an autism diagnosis for their child?
Okay, after receiving a diagnosis,
Mm.
it is common for the parents to feel scared,
Yes.
shocked,
Mm.
or what to do next. That
Mm.
question will come to their mind.
Mm. Yes.
So there is no rush. The first step is to take that they have to give themselves time to
Mm.
process the information, and they have to understand what is autism. They have to understand autism gradually.
Mm-mm.
If they need, they can seek help from professionals or other parents who are going through the same
Mm.
situations, which make them feel they are not alone in this situation.
Okay.
So they have to find out the strength, even if it is small.
Mhm.
They have to find out the strength in that child,
Mhm.
because the small strength can or small interest can make bigger development for the child.
Yeah, that will be more comforting for parents also. So, if a parent says, "I feel more exhausted and but I can't stop," how would you guide them?
See, this is something that most parents feel. See, they have to realize that they are not machines, they are also
Okay.
humans.
Mm.
They need to take proper rest to make the caring more effectively. See, they if they are taking rest for some time or taking a break from that thing, it doesn't mean that they are neglecting their child. So few tips are that they have to take short break, or they can ask others to step in, or even sitting for a few minutes can help. See, they have to realize that caring for themselves is also a way of caring for their child.
So, taking a break is also fine for parents, right?
Yeah, right.
So, what are the simple coping strategies that can manage or prevent the parental burnout?
See, there are simple steps, but it is the most effective step.
Okay.
As I said earlier, they can take break up to 10 minutes. That
Mm.
can help them. And they have to talk openly about their emotion to others.
Mm-mm.
They can seek help from their family members or even their spouse.
Mm.
And they can maintain a daily routine to reduce their stress, and also can do daily exercises to calm their mind. So I am saying that this won't remove stress completely,
Mm.
but we can maintain our stress.
Okay, at an extent we can maintain.
Yes.
So that was a good information. So, ma'am, how important is parental training and psychoeducation in improving the emotional well-being of the parents?
So the parental training help the parents to get a clarity.
Mm.
So if a child is in a behavior, they will get to know why the child is behaving like that. So that can reduce their confusion and can increase confidence. So they can maintain their daily activities along with the child's necessary things and
Okay.
all. So according to me, actually, it's very helpful to seek and help from professional.
Mm. Okay, so the clarity makes a big difference.
Yeah.
Okay. What role does the support from spouse, family, and communities helps in preventing the burnout?
Actually, support plays an important role in reducing this burnout.
Okay.
Even support from spouse, family members, or even we can seek the help of a therapist
Mm-mm.
or other parents who are going through the same
Okay.
situations. That can make a lot of changes in reducing the burnout. So, if I am saying that, they can ask their need or help openly to others.
Okay.
See, if they want help, they can ask them openly. See, I am going through this type of situation, so I need help. Or can you look after my child for a few
Mm-mm.
minutes? Or can you listen? At least they can listen to them for a
Okay.
few minutes. That can really help them to reduce the burnout.
Okay, so this really shows that we can't do it alone.
Yeah.
We need someone's help.
Yes.
Ma'am,
Yes.
let's move on to our last question. Can improving the parents' emotional well-being can also improve the child's progress? Like how these two are connected?
Actually, there is a strong connection between the parent emotional well-being and the child progress. See, the children, especially with autism, they are very sensitive to their environment. They can easily catch up on the stress, anxiety, and the emotions that are happening around them. So, if the parents are emotionally stable, or they are calm, or they are patient, that can help the child to progress or grow positively.
Okay.
So they can learn, communicate, and understand more things. So the parents need to realize that taking care of their emotional well-being, through that they are creating a secure environment for their child to grow.
So you are saying that the connection between the parent and the child is very powerful.
Yes.
Okay. So that was our last question. Thank you, ma'am. Thank you for sharing your valuable insights with us. It truly means a lot.
Yeah, I hope that this helped the parents to realize that they are not alone in this journey.
Okay. Thank you for being part of this meaningful conversation. So remember, taking care of yourself is as much as important as taking care of your child. Thank you.